was born in Italy in 1820. She lived during a time when many women did not receive educations. However, she was highly educated by her father and her aunt. She spoke several languages and excelled at mathematics. She authored several books, and she raised over $70,000 to open a private school. She was raised in a life of luxury, yet she left it to pursue a career in one of the lowest valued jobs at that time. She then changed the face of that career, and now her name is recognized by everyone. She was an excellent nurse, reformer, and statistician. She was Florence Nightingale. She was first a nurse. In Florence Nightingale's day, nursing was one of the most looked down upon jobs. It was a position held by prostitutes, prisoners, and the lowest class members of society. It was not a job mothers and fathers dreamed of for their children. However, it was a job that Florence Nightingale dreamed of doing. At the young age of 19, she left her father's house to travel abroad studying the way hospitals operated. 1 year later, she began her own studies. She excelled in those studies, and 3 years later was offered the position as superintendent of a hospital for women. She served in this capacity for a year when the Crimean War broke out. She volunteered to travel to the front lines to assist in any way possible. She so changed the way nursing was performed on the battlefield, and changed it with so much noted approval that the Minister of War offered her a job as director of all nursing operations during the war. She was an excellent nurse and comforted many wounded soldiers, thus earning her the much endearing title Lady of the Lamp. Many soldiers knew that when they saw that lamp coming, help was on the way, but she was not only a nurse, she was also a reformer. Sanitary conditions on the battlefield were atrocious. Amputations were being performed on one patient and then another, without the doctor cleaning his operating area, his tools, or even washing his hands. Patients were crowded in with each other without proper ventilation or hygiene practices. Food was scarce and infections abounded. Florence began making changes slowly but surely. She began writing letters to the newspapers of the day asking for supplies to be sent. She called for the Sanitation Commission to come in and clean out the sewer system. She worked with a few doctors and convinced them to take a few extra minutes to clean the area they worked in and their equipment between patients. She also encouraged the use of hand washing to reduce infections. At this time, regular water was being used, and nothing resembled the sterile environment of hospitals today. However, just by changing these few things, the death rate dropped from 42% to 2%. Doctors began to see the changes being made, and more of them started following Florence's ideas. Her reforms changed the face of battlefield nursing and ultimately the face of nursing everywhere. But her reforms alone did not make her famous. She was also a statistician, and the statistics she helped gather made her name a well-known name. It would have done no good to simply enact reforms that would eventually be forgotten. She wrote down the results of the reforms. She began keeping records of the wounded and of the ones who died. She also kept a record of the reasons they died, whether from their wounds or from the infections present, and what those infections were. She also kept a record of what changes were made and the results of the changes, such as the decreasing death rate. She charted these statistics in charts such as pie charts, which was a new idea. Her research was studied by doctors on the battlefield, and it was hard to argue with such astounding results. She took all of her research back and began using it to change the way hospitals operated. There were many opposing viewpoints, but once again it was hard to argue with the results. Her research and statistics was what ultimately convinced medical professionals to change the way things were done. Many of her changes are still in effect today, and the results are still being felt. Florence Nightingale was an exceptional nurse, a prominent reformer, and a thorough statistician. Her work in these three areas changed the face of nursing and the medical profession. She was a hero in her day, not only to those wounded soldiers comforted by the sight of her lamp, but also by families who were able to be reunited with the beloved soldiers whose lives she saved. Her tireless work will forever be remembered, and she will always be revered. Henry Wadsworth Longfellow described her best in the second-to-last stanza of his poem titled Florence Nightingale. A lady with the lamp shall stand in the great history of the land, a noble type of good, heroic womanhood. Thank you.